I'm Anita Huberman. I'm CEO of the Surrey Board of Trade. We are Surrey's city building business organization. I'm also honorary captain of the Royal Canadian Navy. And Surrey is going to be the city in British Columbia. And we're so pleased to be with you here this morning. I'd like to acknowledge that we are on the unceded territory of our Coast Salish people, specifically the Kwantlen-Katzie, Semiahmoo, and Tsawwassen First Nations. Events like this simply do not take place without sponsorship support. Thank you to our business and international trade center sponsors, the law firm of Fasken. Thank you so much. The Business Development Bank of Canada, BDC, thank you. And the Chambers of Commerce Group Insurance Plan represented by S&F Benefits. Thank you all for your support to the Surrey Board of Trade. I'd also like to recognize Eric Harvey, representing Ken Hardy, Member of Parliament for Fleetwood Port Kells. He's on the Zoom technology call with us. Stephanie Cadu, MLA for Surrey South, and City of Surrey councillors Alison Patton and Stephen Pettigrew. Just some instructions before we begin. All attendees are muted. If you have a question, please put it in the chat function of the technology. We will get to your question after the presentations. And if we're not able to get to your questions, we will respond to you by email after the session is over. Just a couple of introductory remarks. The Surrey Board of Trade, our whole mandate is to support business, bring business into the city. We have the only pandemic rapid response business center in British Columbia in partnership with the BC government, where we have also developed the first COVID-19 playbook for business, a variety of resources in print, digitally, but also providing that in-person support in different languages right here at the Surrey Board of Trade. The Surrey Board of Trade, we have 6,000 member contacts. We're one of the top 10 largest chambers of commerce, boards of trades in Canada. There's 450 of us, and we've all been supporting and helping our business community, our not-for-profit sector during this pandemic. And we're still here for you because in the year 2021, we're waiting to see how the vaccine rollout is going to impact our lives, how it's going to improve our economy. Surrey itself, from an industry perspective, is faring very well. Many of our business sectors were able to stay alive and be functioning, supplying those goods locally and internationally. We have the greatest number of manufacturers within British Columbia. We're a border city. And I just wanted to let you know that Surrey and British Columbia itself is, from an economic standpoint, in a very positive position. But we must understand the vaccine rollout, and we must understand the implications to our workplaces. What are our employer rights? Is the vaccine safe? Who do we go to? When is it our turn? And we want to hear from you. I sit on the Premier's Economic Recovery Task Force. I sit on the Economic Development Minister's Industry Engagement Table. And we have a direct line into the Prime Minister's office to identify gaps and opportunities for the business community during the pandemic and beyond. So now it's my pleasure to welcome our first speaker. He is Thomas Reyes. He's Executive Director of the Surrey North Delta Division of Family Practice. Thomas, your remarks, please.
Good morning, everybody, and thank you, Anita, for having me here. It's an honor to be here today. I'm the Executive Director of the Surrey North Delta Division of Family Practice. Our organization represents 534 members in the medical community. 300 of those are actually full-time, full-scope family physicians working in Surrey and in North Delta. And part of the work that we do is obviously supporting physicians to provide the best care possible to their patients, but also partner with a health authority and other partners in the community to look for opportunities to improve healthcare and support wellness in the community. And so to that extent, and for that reason, in terms of the COVID-19 strategy, we've been very, very involved in the conversations on how we actually deploy these and how we support the community at large. So the intent of today is to present kind of a snapshot of where we are at, a little bit of information about the vaccines, actually, I should say, and some additional details on top of what was already shared earlier this month around the deployment and the rollout of the vaccine strategy. So I'm gonna share my screen here, and hopefully it will work well. Hopefully you can now see me, see the presentation there. And I don't know if you're actually seeing my presentation. Anita, can you confirm if you are seeing the presentation? Okay, perfect. Thank you so much. So, yeah, this is me, and this is the organization that I represent. I have a couple of important disclaimers. So first of all, there's no personal or professional gain from this presentation. There's no conflict of interest, or at least I couldn't identify any conflict of interest in regards to the information I'm going to share. I'm not an expert on the topic specifically, although I'm very involved in the conversations and in the deployment of the plan. And I have no clinical background, so clinical information is out of my scope. I will do my best to have answer questions that you may have for me, but I have to defer to the clinical experts if they are of clinical nature. The information to be shared here is already public for the most part of it, but acknowledging that it's coming from multiple sources, I tried to put like kind of a good snapshot of the preliminaries about the vaccines and the rollout plans for your information. Some of those sources are the BCCDC, of course, the government of British Columbia, and Fraser Health. Information may, and so far has been changing quite quickly. And so my big disclaimer here is that the information I'm presenting may become irrelevant in a couple of weeks or not. And so therefore, I will always encourage people to keep reviewing official sources as we go through this journey together. Okay, so in terms of the vaccines, right now we have two vaccines available in our community, in our province. One is the Pfizer BioNTech and the Moderna vaccines. Both of these vaccines are what they call mRNA type of vaccines. Just to be more specific of what that means is they deliver genetic instructions from the virus to our own cells. And these help the body to produce the spike protein of the virus. Then this protein stimulates our own body immune response. So in a way, it's not a virus. These vaccines are quite different from actually those that contain part of the protein or actually inactivated virus. That's very important because this technology, although newer, is not new. It has been used in multiple vaccines before. And actually that's what helped kind of fast track the process. I know that there's anxiety of how safe they are. And if we cut corners, like no corners were cut, they just fast track the process because the focus was on developing something quickly based on technology that was already existing. There are a couple of nuances and differences between the two vaccines, although in general they work similarly. So as you can see on the table on the screen, Pfizer is actually for individuals over 16 years old of age. It has shown 95% of vaccine efficacy after the 2-dose series. Typically, it will take 7 days after the second dose to develop optimal protection. Some of the contraindications for that one is that actually the only contraindication is you may have had a life-threatening reaction, which is called anaphylaxis to a previous dose of the COVID-19 vaccine. And of course, that for the most part of us, we won't know, but also to any other component of the vaccine. There is a list in one of the references I'm sharing with you later on today. There is a list of the components of the vaccine. And if you are aware of those, of course, you should avoid it. And you should always talk to your healthcare professional, physician or so to actually address those concerns and those issues. Other than that, there's no other contraindications so far identified. Reactions, no serious adverse events have been reported, neither in clinical trials or actually after the application of the vaccine to all the people that we have applied already. typical side effects are similar to other vaccines. So if you, let's say, after vaccine you get sore arm, or actually inflammation in the local area, some headache and some dizziness, that's typically what you will get after this. No major reactions. With the Moderna vaccine, it's equivalent. It's similar. It's 18 years old. The minimum age recommended. Shows 94% efficacy after 2-dose series. May take until 14 days after the second dose to develop optimal protection. Similar contraindications to the Pfizer one, and the reactions are also similar to the Pfizer one. Something important is that these two vaccines are very difficult to handle, and they require very low temperatures to have optimal response. Therefore, that's part of the reason it's actually being provided in a limited capacity. So between the supply available and the difficulty to handle it, the rollout has to be very careful. Of course, the government is looking at other alternatives. One that comes to my mind is the AstraZeneca one, and that are easier to handle and therefore more prone for mass vaccination efforts. So that's something to keep in mind. In our provinces specifically, and in our city specifically, we are not getting the Moderna vaccine as we would like to. That vaccine, because it's easier to handle than the Pfizer, it's actually currently utilized for remote Aboriginal communities, like actually what they call rural and remote communities. So not necessarily accessible to urban or suburban populations right now. Some additional information: these vaccines will protect people from getting sick from the virus, but not necessarily, and we don't know yet that they will actually eliminate the virus. So after you get the vaccine, you may still possibly carry the virus and actually be contagious. We're still learning. This is uncharted territory, so we need to be aware of that, and we're learning as we go. For some of these vaccines, there is still a clinical trial period that actually goes for up to 2 years, and so they continue learning. But as I said, so far the information is pretty benign. The positive impact and result actually overcome any potential issues so far identified, and therefore that's why it's highly recommended for everybody to take the vaccine. Today, the vaccines seem to work with the already identified mutations of the virus. I think we have identified 3 so far, and they seem to be working for those. Of course, the commitment is that the vaccines can be updated as needed if a mutation doesn't respond to the vaccine, and that's identified. Some of the current recommendations, unfortunately, will need to continue. So social distancing and wearing a mask, as an example of those, will need to continue even after we reach some mass immunization through the vaccines. The rollout plan. So earlier this month, the government made official announcement of the rollout plan. This was the official announcement. Actually, the rollout plan started in December, late December, and it's divided in 4 phases. We have on your screen, you can see the ones that are in red. The phase 1 and phase 2 are focusing on high risk populations, while the yellow ones on the right are actually focused on general population. And as you can see, the dates, those are projected dates based on current forecast of availability. So these may change if availability becomes scarce or something changes. Of course, if we get authorization to use another vaccine like the AstraZeneca one or any other, of course, that may expedite the process as well. So right now, keep that with a grain of salt and understand that these are projected dates based on the forecast of availability. For the phase 1 and phase 2, and I'm sorry for the small print, this is taken directly from the website, from the official website from the government. Phase 1 is focusing on really, really frail, high-risk populations, where unfortunately and sadly we have been facing most of the deaths. So residential care is one of the main targets, and then hospital healthcare workers that may provide COVID-19 assistance. And so these are like intensive care units, emergency departments, paramedics, medical units, surgical units, etc. And then at the same time, through the Moderna vaccine, obviously the remote and isolated indigenous communities that I mentioned before. Phase 2, which is starting from February to March, still projected. They will start with seniors age 80 and over, even if they are not in long-term care facilities. Indigenous, First Nations, Métis, and Inuit seniors age 60, 65 or over. Hospital staff, and then family physicians and specialists that may not have been immunized by then. And what I mean with that is some of these physicians already provide support at the long-term care facilities, and therefore they may have already received the vaccine by now. And so the majority of them, though, haven't. And so it's one of the priority populations because they deal with patients all the time. And then vulnerable populations living and working in select congregate settings, and staff in community home support and nursing services for seniors. As we move into phase 3 and phase 4, we will start with the majority of the population. And so basically phase 3, which is projected for April to June, will start in brackets of 5 years of age from older to younger. And the groups that will be considered will be from 79-year-old to 60 years old. And then there are some people aged from 69 to 16 who are clinically extremely vulnerable. And there is actually, if you go to the government website, there is actually a link to explain what that means. That may qualify also, will qualify also for phase 3. And then phase 4 will be the rest of the population from 59 to 18 years old, in brackets of 5 as well. As the note says there, once additional vaccines are approved and become available, people between the ages of 18 and 64 who are frontline essential workers or work in specific workplace or industries may be included in the later part of phase 3. So I know that there has been a lot of multiple asks from multiple groups about being considered as priority populations. And the thing is that as the government has responded, this is a matter of supply and availability. Like if a group is included, something has to give in. And so it's they are looking for where the major impact would be in the first 2 phases before actually jumping into an aging strategy for the rest. And of course, this can be accelerated if we get additional vaccines. What does that mean for Surrey? So in Surrey, Fraser Health already has set up specific sites to support vaccination during phase 1 and phase 2 for the populations before described. Those are the 3 well-known hospitals: Surrey Memorial Hospital, Royal Columbian Hospital, and Abbotsford Regional Hospital. Part of the reasons they went with the larger hospitals first is because they have the infrastructure to support, as I said, the handling of the vaccine and the deployment of the vaccination strategy. During phase 1, specific in Surrey, we have one of the largest, if not the largest, drive-through for COVID testing in Newton. You may be aware of that. And so we have actually started already a trial for long-term care patients through the drive-through, and it was successfully implemented. And so we believe that we have the capacity and the ability to expand on that ability to provide vaccination through drive-through capacity when we get into phase 3. As we move forward, the rollout strategy locally under development is so in preparation for these massive vaccination efforts for phase 3 and 4. We are considering different opportunities. Nothing is confirmed yet, so I need to put that big disclaimer there. However, some of the things that we have considered and we are thinking about deploying is, as I mentioned, a hybrid model for the drive-through facility in Newton. The COVID-19 site in Central City, which is a walk-in, we probably converted it into a full vaccination facility. It has multiple stations and it is conducive to support that effort when the time comes. So it's still under review, but probably that will happen. We're lucky enough that we have 2 urgent and primary care centers in Surrey, one in Wall and one in Newton. Those 2 have been fundamental for actually the support for flu vaccination strategy and COVID assessment and testing in the early days. And so we will probably use them for COVID vaccination strategy as well. And then depending on availability and the vaccines that get approved in the future for mass vaccination, then obviously we will also rely on family physician clinics practices and potentially pharmacists as well. Just some final words. Vaccination is strongly encouraged. They don't only protect you, but the people around you. Vaccination is still an individual choice. in the official message, and that doesn't seem to be changed, like it's going to change. The vaccine rollout plan is subject to stock availability and ability to continue accessing inventory. As I mentioned that multiple times, this is very important to understand because that's the main constraint that we have at this point. The government is exploring authorizing additional vaccines because of, as I mentioned, the ones that we have are difficult to handle, and not that that poses any risk, but actually the only risk is that they will be ineffective. So they need to be handled with like utmost care and by professionals, and very well trained professionals, so it actually has the effect that it's supposed to have. We are obviously, as I said, to a certain extent in unexplored territory. So however, the vaccine technology is not new, and although they were fast-tracked because of course of the need and the focused efforts to do it, there were no corners cut in bringing them to public use. So that's an important understanding. There are multiple rumors and concerns, like if the vaccine will alter my DNA, if they have animal products in them, if they have any, they will cause for me to get sick of coronavirus. Like none of that is true, at least with the ones that we have so far. So please inform yourself, help educate others, go to official pages. There are multiple sources of information with trustworthy information about the vaccines. Don't like, there's also a lot of misinformation out there. So we just need to be careful what we pay attention to and kind of avoid rumors and concerns of that type. And then, as I mentioned at the beginning, information is quite fluid and it's updated as new information becomes available. So please continue reviewing, monitor, and monitor official sources. Some of the ones listed there, you are probably very well aware of, like the COVID-19 dashboard, the COVID-19 vaccination at a glance from BC CDC, the COVID-19 frequently asked questions from Immunize BC, the COVID-19 immunization plan from the province of British Columbia, so official government page, the coronavirus disease outbreak update from Canada.ca, and of course, the COVID-19 web page from the Fraser Health Authority. And that's about it, Anita. Thank you so much for the opportunity.
Thank you so much, Tomas. And ladies and gentlemen, you'll have a chance to ask Tomas questions very shortly, but please help me welcome Mr. Jordan Thompson of the law firm of Fasken. And he's going to address what are the rights of employers, employees, and businesses. Jordan, over to you.
Hi there. Thank you, Anita, and thank you, Dr. Reyes, for the informative presentation. I appreciate the opportunity to get involved with this webinar, and I do hope that the presentation is useful for everybody. So in terms of my presentation, and there will be a Q&A portion following, I do intend to cover some of the major questions and issues that seem to be pertinent for most employers, and that certainly me and my colleagues are receiving on a fairly regular basis. Before I do get started, I will mention, as Dr. Reyes alluded to, this is uncharted territory in the health sector, and also I would say in the legal sector as well. So a lot of the information we're working on currently, I suspect will change over the course of the next several months. So the first major issue or question that we're getting a lot of is, whether an employer can require an employee to get vaccinated. As I just said, at this point in time, it's not really a practical question. You've seen the vaccine rollout plan, and until vaccinations are available for the majority of or all of Canadians, a requirement to be vaccinated before coming to work is not going to be reasonable. That said, I will say that employers generally cannot require employees to accept any form of medical treatment. And, whether it involves examinations, treatment, or other type of intervention, such as a vaccine, those would all be covered. There are, of course, exceptions to this general rule. The first of those is where, a government introduces legislation requiring something like a mandatory vaccination, which we have precedent for in the past. I understand in Ontario, there's immunization requirements for paramedics pursuant to legislation in that province. But in the event that this does occur, it certainly won't be general. It'll be industry specific, and certainly the government will be carefully considering where it does implement such things, because they'd be subject to challenges under the Charter of Rights and Freedoms, of course. And the second, and probably more important exception for most employers, is where the employer would be looking at an exception to meet their requirements under occupational health and safety legislation to provide a safe workplace and all reasonable precautions in that workplace. And there's no real precedent for this. Like, this is uncharted times. It's been 100 years since there was a pandemic, and the law has changed drastically. But what I do suspect is that we'll see some test cases from long-term care facilities where employees regularly have close contact with immunocompromised individuals. And that's where we'll see this argument put forth first, to see how it applies to other workplaces generally. But like that said, I can't stress enough that whether one of these exceptions applies, it's going to be case by case, and it's going to depend on the specific workplace in question. The other thing worth noting on that point is, if a mandatory vaccine policy is considered and put into place, employers are definitely going to want to adhere to privacy legislation regarding the handling of personal information, health information, and also allowing for accommodations for purposes under the Human Rights Code, which I will talk about a bit more shortly. And so another question we're getting commonly, and I think a lot of employers are interested about, is whether an employer can require proof of vaccination before an employee comes back to work. And this is, of course, highly related to, whether an employer can mandate vaccinations. So all the things I just covered would equally apply, but also, requiring proof of vaccinations also creates a trigger of privacy legislation in terms of the collection of vaccination status. Generally speaking, employers aren't entitled to this information unless there's a reasonable reason for the collection. And again, that's going to depend largely on the nature of the workplace and the operation in question. Assuming that the workplace safety is the goal, personal information regarding vaccination status might reasonably be collected, depending on that workplace. However, with the uncertainty about the vaccine, if there are other just as effective means of providing a safe workplace, such as providing, PPE, screening questionnaires, physical barriers, as we've all seen and experienced over the last, 10, 11 months, then the collection of vaccination status becomes less reasonable and arguably unreasonable in those circumstances. Again, I think, if we're dealing with a high-risk industry, knowing the vaccination status for employees at a place like a long-term care home is much more reasonable, and requiring proof of vaccination in that situation would be much more defensible. Taking the other hand of example, if we're dealing with a workplace with minimal contact or customer interactions or employee interactions, remote work, individual work, the collection of vaccine status is very likely not going to be held to be reasonable. So if it comes down to it, and the employer does take this approach to requiring proof of vaccination, it's still going to be very important to, at a minimum, be compliant with PIPA, or the Personal Information Protection Act, which is going to require employers to, provide notice to employees regarding collecting, using, and disclosing that personal information. And then they're going to take all reasonable precautions regarding, the confidentiality and protection of that information. As with a mandatory vaccine policy, the collection of proof of a vaccination is going to be highly, case specific, and there's some significant legal hurdles that, need to carefully be navigated if an employer is going that route. Another question that we've seen a little bit of, and it's less so related to the employment context, and then more so related to the provision of services. But whether a business or employer can prevent non-vaccinated guests from entering their premises. I mean, there's a ton of practical hurdles with such an approach in terms of, how are we requesting that information from people? Is it self-disclosure? Are we asking for, proof of the vaccination cards, which I understand are being issued? But you run into the same privacy concerns that I was just discussing. The disclosure of vaccination status, it would only be permissible if there is not a less intrusive means of assessing risk and ensuring a safe business. For example, as I just mentioned, employers can and are currently mandated to establish, screening policies that require visitors to provide information on whether they have tested positive for COVID, whether they've left the country, whether they've had any symptoms in the last 14 days, and sometimes temperature screenings. So, those are all very reasonable alternatives to limiting risk in a business or workplace. So, getting to the threshold where it's justifiable to require proof of vaccination is going to be a very high risk business. Like I said, I think the test cases will be long-term care homes where there's close contact with, high risk individuals or immunocompromised individuals. And otherwise, I think it's very unlikely that such an approach would be justified. Refusing business on that ground as well also carries with it some significant human rights issues. It's discriminatory for a business to refuse the services they offer on the basis of a protected ground. It's not surprising to anybody that individuals may be refusing to get vaccinated on the basis of physical disabilities in terms of, allergies or other risks, obviously on religious or on the grounds of creed, would also raise significant issues. So unless an employer could point to what the law calls a bona fide justifiable reason for requiring proof of vaccination, then refusing service to these individuals who haven't been vaccinated could result in breaches of the Human Rights Code. And then the other last question that I'll cover in my presentation that we've been getting a lot of is, what type of policies can and should a business put in place? And again, I think the answer to that is largely dependent on what we know at this point. Many employers are considering implementing vaccine encouragement or voluntariness policies. As Dr. Reyes alluded to in his presentation, there's no requirement to accept a vaccine, and there is an encouragement at, I think, almost every level that it's better if everyone does receive one. So, I think that's the proper approach for employers to follow at the moment. I know that some employers are considering something like incentive programs for employees who do get vaccinated, such as, go get vaccinated, take the day off with pay or a half day. But with that approach, you still run into issues about, privacy law and the collection of sensitive information if you're confirming that people did in fact receive vaccination. And then I will say as well, if employers do go down the road of implementing, eventually mandatory vaccine policies, it's going to need to clearly set out the requirements of the policy, and you're going to want to provide for consequences of failing to follow that policy. If you're looking at, what type of action an employer can take for a non-compliant employee. Of course, the policy should also set out the employer's commitment to protecting the employee's privacy rights, including all the use, collection, and disclosure requirements under privacy legislation that I referred to. And I would also recommend that any vaccination policy take into account, the accommodation principles for human rights reasons that I had flagged before, such as, refusal or inability to receive a vaccine on the basis of, religion, culture, physical disability. So I think that would answer the four kind of main questions we've seen the most of. And as you can tell, I don't have a great specific recommendations at this time, because it's really a moving target and it's very case by case specific for most employers. So that would bring the end of my formal presentation. But if there's any questions for follow-up, I'm happy to take those. Thank you.
Thank you so much, Jordan and Tomas. So ladies and gentlemen, it's now over to you for some questions. Please type them into the chat function and I will get to them. So Tomas, if you can turn your screen on. And the first question for either of you is, what about post-secondary students from out of the country? Can an institution indicate or ask for a proof of vaccination? Who wants to take that question?
So from the perspective of healthcare, it's interesting because, of course, right now the focus is within the population that actually currently lives in BC. I have to recognize that and acknowledge that I don't necessarily have a proper answer, Anita, and I don't want to misguide the public on this, just to be quite fair. I can find out and come back to you from the health perspective about it. I think you mentioned something specifically, that there is a requirement. And so I think and that this is me making a story about it, it's actually the requirement has to be prior to actually arriving into Canada. But I can find out more from the healthcare perspective.
And for the person that asked that question, we will get the answer, more specifics for you and email you back. Jordan, did you have any comments on that?
It's an interesting question, and I'm not sure that I can speak to validity of again, the requirement of a vaccination before is somebody international. So I mean, we don't know what access to the vaccination they have in their place of origin, or any of that. But I mean, as long as the person's complying with entrance requirements to the country, I mean, I think a post-secondary institution would have a difficult time trying to enforce such a policy, given that I don't think it would be enforceable generally against other students, despite place of origin. So, I mean, and there's definitely a host of other, issues, human rights and privacy concerns as well, and even charter implications to the extent they apply to universities. So I think, that it's a fairly loaded question. And I think right now I wouldn't be able to give exact guidance on it.
Jordan, companies and organizations have two things to worry about. One is about the health and productivity of their employees. The other dimension also is about the image in the broader population and on social media. What should companies really do? How can they remove all the barriers that there could be for their employees to access these vaccines for those that can take them or want to take them?
Right. Well, that's an interesting question too. I mean, I don't particularly understand the concern. The other dimensions about broader image, population, and on social media. I mean, what I think is important is that, companies encourage the vaccine, but at the same time, there needs to be a recognition that companies are following and adhering to other public health and WorkSafe BC guidance on the topic. So, it's not just like at this time, it's not treating, we encourage the vaccine, but it's not the be all and end all of our commitment to safety in the workplace. We're going to continue to follow these other protocols that have been successful thus far, fairly successful thus far, and we're going to monitor those. And then I think the other thing is, companies need to be transparent that these are unprecedented times, and no one has the answers. Employers are doing their best to navigate all of the occupational health and safety obligations, but also managing employees rights and privacy rights, human rights, and as well as looking after their bottom line, right? So it's a very difficult time for companies, and I think transparency with the approach is important, and keeping an open dialogue with employees is important as well. I don't know if that answered that question, but I hope so.
Thank you so much, Tomas. You know that Surrey is a very multicultural community. 104 different languages are spoken in our city. Tell me what your perspective is when an employer comes into an issue related to cultural beliefs, and they believe that they shouldn't take the vaccine. What do you do in this instance from an education perspective related to the vaccine? And then Jordan, over to you as it relates to this question from an HR perspective.
So I think it's like the most important piece is in general in healthcare we always are confronted with this situation of mainstream delivery of healthcare versus kind of being equitable and actually prone to diversity based on the multiple cultures, as you mentioned, and backgrounds that are in our community. So that's a challenge, of course. And having, as you said, more than 104 different languages and potentially backgrounds, it makes it complex. I think the most important piece is we need to listen. We need to understand where the concern is coming from. First of all, I think, as I said, many of those concerns may actually be founded on rumors that people heard about, or stories that were formed based on rumors or kind of perpetuated misinformation. And I think the importance is to understand where the concern is coming from. Ultimately, I think the importance, as we have discussed plenty, it is a personal choice ultimately. And I think the importance is to recognize that the vaccine is not only to help you or the individual, it's actually to help the people around the individual. That may still not be enough reason for people for an individual person to take it, and it's their choice. But there is a risk associated with that choice. I think if there is a religious or cultural concern, I think we need to understand it and then clarify transparently, as Jordan said. I think transparency is the most important piece. I have actually seen physicians already promoting, based on certain cultural backgrounds, about this information about like if the vaccine has animal components, and addressing that that's not the case. If they are actually endorsed by certain type of organizations that may actually support certain traditions for certain cultures, and they are. And so I have seen already an effort from individuals in the community, physicians in the community, promoting that. And I think we can do more, definitely. I think we need to understand what the concerns would be.
Jordan.
Yeah, I don't think I have anything to add on the basis of, how an employer could dissuade, or sorry, how our employer might, motivate or encourage somebody to accept a vaccine. And I don't think that's an employer's role. As Dr. Reyes said, people take that information from people like himself who are informed of the matters and the benefits. What an employer's obligation is to, as I said, I'd recommend encouragement and an open dialogue in terms of the vaccination. But, ultimately, an employer needs to abide by the laws that apply to it. And what this means here is recognizing people have different opinions on matters that may be informed by legitimately held cultural and religious beliefs. And employers have an obligation to accommodate individuals on that basis. And if that means somebody says, I'm not getting this vaccine, then the employer has a legal obligation to, assess what that means for the employer. What type of work arrangements are going to be suitable for this person if the risk of having somebody non-vaccinated in the workplace is too high? You know, are we looking at work from home situation? Are we looking at increased use of you know, PPE and other measures as explained by WorkSafe? And I mean, what I will say though is the employer's obligation only goes to the point of what's known as undue hardship. So once that threshold is met, it's not like the employer needs to, you know, change their operation or create a new job for somebody that's, you know, refusing on even on a reasonable basis. And again, you know, just drawing back to the same example of a long-term care home, if somebody in that position is also somebody who holds cultural or religious beliefs to refuse a vaccine, but they work, you know, in close contact with people who are highly at risk to the virus, that might be that type of situation where you say just employment's not feasible in this situation, and we're going to have to find, you know, either something that works otherwise, or the end of the relationship can occur there. And there's risks involved, but I mean that happens every day in different types of jobs, right? So it has to be managed on a case by case basis with like specific operation in mind as well. It's a good question though.
Jordan, do you and your team at Fasken have a perspective on, you know, making sure that people in workforces don't have to choose between getting paid and getting vaccinated, creating policies that protect wages, providing paid time off for vaccination, you know, this whole concept of sick pay, you know, through the BC and federal government has come into play during the pandemic now more than ever. What is Fasken's perspective on that?
Right. Okay. So, I mean, a couple aspects of that for sure as well. In terms of like the simplest form, you know, a lot of employers that you know, we've been getting questions from and advising on, you know, they're curious about, I refer to it as kind of an incentive approach, but, you know, giving people paid time off to get vaccinated, giving them that free time away from work to do that. And then, you know, it's a difficult question on that in that sense, because like, you know, once it's available to the general population, and Dr. Reyes would probably speak to this better than me, but how will that vaccine be administered to the general population? You know, will some workplaces offer it in-house? Will you have to go to a pharmacy, to your London Drugs or your Shoppers? Or like I heard in the States, you know, it's more of like you drive through a Costco parking lot and everyone's getting it done there. So, you know, like the practical aspects of getting it done could be important for compensation for time off work as well. But I mean, maybe the question is also asking about, you know, a lot of there's no one size fits all approach, but you know, a lot of employers, of course, have paid sick time. COVID job protected COVID leave has now been added to the BC Employment Standards Act. So employers are prohibited from you know, terminating or taking any adverse approach to an employee's COVID related time away from work. And then, of course, as you said, Anita, there's a host of benefits and other types of alternative compensation available to people who are away from work for those types of reasons. And probably the most common approach is employers topping up, you know, where appropriate, where people are away for those reasons, or if it falls under their sick time off policy. But really, you know, there's no one size fits all for that either. It's you know, small companies will have a lot harder time with that than larger organizations. So you know, I think it has to be weighed again case by case.
Tomas, with the vaccine, and you may or may not have the answer to this, is what about in this first rollout of the vaccine, people who have allergies or people that are immunocompromised? You know, what is, you know, their ability to get the vaccine, or should they consult with their physician?
So right now, so there are a couple of pieces there. Like, so from the perspective of when to get it, and from the perspective if you should get it. So from the perspective if you should get it, as I mentioned in my presentation, like there's no contraindication except if like a formal a reaction to any of the already disclosed openly components of the vaccine, and that actually are similar to any other vaccine in the past. So acknowledging that you may not have experience with the COVID-19 vaccine specifically, the components additionally to the mRNA component of the vaccine are actually shared across multiple vaccines. And so if you are aware of that kind of reaction allergy, then definitely that's the only contraindication why you shouldn't take it. If you haven't experienced that at all ever with any kind of vaccine, there's no reason why you shouldn't. If you have an immunocompromised system, officially also the information says that it is recommended that you talk to your primary care provider and make sure that there's no implication, but most likely there won't be any implication. So it should be, I hope that addresses it. From the when you should get it, if you have these instances, they're going by certain kind of what they consider prior populations based on age and frailty. If you are not within the target of the first phase or second phase, there may be exclusions for you to actually be part of particularly the second phase instead of waiting for the age group and the third or fourth bracket. And so basically there is a very descriptive list of what would be the possibility. And so I would encourage that you go through, like people having that concern, go through the website from the government that actually has a link specifically to say what kind of cases would probably qualify to be expedited and then being fast tracked. Other than that, they are deciding at this point to go by age for the reasons I explained before.
And you can also check out the Surrey Board of Trade Pandemic Rapid Response Center for those government links at businessinsurrey.com. Jordan, my last question is over to you. What if an employee refuses to get vaccinated, but then has COVID in the workplace? What are the accountabilities of that employer?
Meaning they contract COVID in the workplace?
Yeah, so
okay.
Yeah, so the question is in the chat function there.
Oh, okay, sorry. Yeah.
So if an employee refuses to get vaccinated, but then contracts COVID at work, what might the effects be on the employer? What is the employer's responsibility?
Right. Okay. Yeah. I don't think that changes anything than it is currently right now. You're saying if the employee refuses to get vaccinated, but there's no mandate for them to get vaccinated. So, the same WorkSafe BC type of analysis would apply. And I think you've even flagged that in your question. Would it depend on the policies and protocols that were in place? Absolutely. Assuming that the employer is otherwise compliant with WorkSafe BC recommendations for safety in the workplace, PPE, hygiene stations, WorkSafe COVID-19 plan, social distancing measures, all the other aspects that we've all been following for several months. As long as those are adhered to, people can still contract COVID in the workplace. It happens, and it's no different than any other situation if they've refused the vaccine, unless this is one of those like really rare situations where down the road, I'm saying if the vaccine is mandated and then the employee has refused, I mean, that's a different question. And there's going to be a lot of questions about why they were there in the first place if they hadn't provided evidence of vaccination, et cetera. But I mean, it would be your standard claim for compensation due to a workplace injury pursuant to, occupational health and safety legislation. So I don't think the refusal would change anything different than it did a couple months ago.
We know that both the federal government and the provincial government have been asked whether or not they're considering mandatory vaccination, and the answer has been no, ladies and gentlemen. But we'll see what is forthcoming as we go through this year. Any final remarks, Tomas and Jordan, that you wanted to make before we conclude? Tomas, over to you.
Thank you, Anita. I just want to circle back very quickly to something that you mentioned about kind of rollout of the plan in the community, right? Like, as I mentioned, at some point we have different strategies that we're exploring to tackle mass vaccination. what we know so far, based on what we have tried, is that typically the time that you will spend at any given location to get the vaccine, it's actually minimum. It may take 10 minutes for you to get the vaccine, and then sometime maybe 10 to 15 minutes to wait for an immediate positive, like really negative reaction. And then after that, off you go back to your normal life as if you were getting the flu vaccine or any other for that matter. So from that, I just wanted to circle that because Jordan asked about that, and really there's no expectation that you will waste a day or even an hour really in the process of getting the vaccine. And in terms of locations, of course, as we get availability of vaccines that are more manageable, we're looking even into maybe getting into pharmacies and physicians' offices, and so it make it available. That's something I want to say. And then my final comment is, I from the healthcare perspective, as I said, except for those specific reasons where I said you shouldn't take it, there's no reason why you should. Like if there are some cultural, religious beliefs, I think we need to talk about them. And when I say with the Royal West, actually talk to your healthcare professionals, and they will be able to address them. And I'm from the perspective of the system, we are developing materials to kind of make people aware, and then just keep reviewing the information as it changes, and be aware of the process to actually register to actually get the vaccine when the time comes. Thank you, Anita.
Thank you, Tomas. Jordan, over to you.
Yeah, and I would just reiterate, as I've been saying throughout, this is a time of uncertainty, and the process is very fluid, as we've seen with the various aspects that have evolved rapidly over the last several months. And I'm kind of in the business of limiting risk for people and avoiding liability. So all I would say is on that front, stay informed, stay aware of the updates, and just keep a fluid approach to your approach to handling COVID in the workplace. Otherwise, thanks, Anita, and thank you everyone for the time.
Thank you so much, Jordan and Tomas. And ladies and gentlemen, this session is being recorded and will be sent to you and will be on social media. Please join us this year for many town halls that will educate and inform you during this pandemic for your business and for your workforce. Check out our website at businessinsurrey.com, and don't forget, next week is our economic forecast lunch with BDC's economist on February the 4th. Thank you so much for joining us. Make it a great business day.